At your most severe level of pain, how would you rate it?
Like a 7.
Okay, so it does get pretty high. All right. You said sometimes your headaches are here in the front, so. All right, Maddie, we're going to go ahead and get started with your assessment today. Okay. It looks like I have you in for a couple different things.
Yeah, I've been having a headache and some like neck, shoulder pain.
Okay, neck and shoulder pain. About how long have you been having that?
About a week or so.
A week, okay, so not terribly long. Would you say that the neck and headache kind of coincide with each other, come at the same time, or?
At the same time, yeah.
Same time. All right. And can you tell me, like, where on your head you feel the head pain? Is it like back of the head, front of the head?
It just depends. Sometimes here, and then
Okay.
sometimes on the back over there.
Okay. So both of those spots tend to be more of like a tension headache, so that's something that I'll kind of keep in mind.
Okay.
And then as far as the neck pain, is there any specific isolation of the pain? Is it just kind of all over?
Kind of all over, but a bit more on the right.
On the right side. Okay. All right. And same with the shoulder. Is it more on the right side?
Mm-hmm.
Okay. All right. And then is there anything specific that you think could be causing the pain or the headaches? Were you in any sort of car accident, any injury or anything, or it just kind of came on?
This kind of came on.
Okay.
Yeah.
So no major life event that occurred.
Mm-hmm.
All right. And is this something that you've experienced in the past? Are you prone to headaches typically?
I haven't for a while, but it's been come and go for a while.
All right. So you do have some partial history of headaches. Yeah. All right. And as far as the level of your pain, would you say it's more mild or moderate? Is it pretty severe, like a 10 out of 10 pain, or does it kind of vary just depending?
Just varies.
Okay.
Yeah.
At your most severe level of pain, how would you rate it?
Like a 7.
Okay, so it does get pretty high. Mm-hmm. All right. And when you feel the higher level of pain, is there anything specific that you're doing? Is it like more at the end of the day or after a long day?
Sometimes in the morning.
Sometimes in the morning. Okay, so not necessarily related to the day that you've had, or are you having any trouble sleeping?
A little bit, yeah.
Okay. And do you think that coincides with the days that you feel a little bit more of these symptoms?
Maybe.
Okay, all right. So it could be due to lack of sleep. Just to follow up on that, how many hours a night would you say you're getting on average?
About 7, maybe 8.
Okay, so not terribly in deficit there. Is it more so that you're having trouble falling asleep or staying asleep?
Yeah, falling asleep
Falling
for sure.
Okay. All right. Okay, so I'm going to ask you a couple of questions about symptoms that may or may not be related, and you can just answer yes or no whether or not you're feeling any of the following. Okay, so obviously we've established that you're having headaches. Now you said you were having neck and shoulder pain. Does that radiate down to the arms at all?
Only on the right.
Only on the right side. Okay. All right, and soreness, obviously.
Mm-hmm.
And you said you've been having trouble sleeping. Any fatigue, like throughout the day? Do you feel like you're more tired than normal?
Mm-hmm. Yeah.
All right. Any elbow pain?
Mm-mm.
Okay, good. And anything more severe, like a migraine pain?
I don't think so.
Okay, that's good. Any pain in the lower back?
Yes, a
Little
few
bit?
times I've
Okay.
realized.
And is that isolated to one side or kind of medial?
Kind of medial, yeah.
Okay, all right. So mid-back pain, we'll definitely have a look at that. Now, would you say, so if we talk about lower back, is it more like tailbone or kind of up above the hip bone?
Like a little bit above the hip.
A little bit above the hip. Okay, all right. So I'll definitely have a look there. Okay. Obvious discomfort. Have you noticed any weakness? Any weakness of the limbs, or just overall not feeling maybe as strong?
Yeah, a little bit some days.
Okay. And is that just like in general in your body, or specifically like with your upper body, your arms?
Yeah, my arms a little bit.
Okay, so general fatigue of the upper extremity. All right, so definitely want to look into that for sure. So let me just take a note here. Okay, so I'll do a couple tests of strength, make sure that it's not, more so that it's not happening on one side or the other. So any asymmetry in strength can be a little bit concerning. If it's bilateral overall weakness in both arms and it's kind of equal, then it's not as concerning. It just generally means there's not an injury of one side of the spinal cord. So definitely want to look into that. All right, and any pain of the lower body, so pelvis, knees, hips, ankles.
Sometimes the hips, but not as bad.
All right, obvious head and neck pain. You said fatigue of the limbs. Any pain of the soles of the feet, arch of the feet? Okay, good. Any upper back pain?
Maybe, but that might just be with the shoulder.
Okay, so just a little tightness there, right? Okay, all right. So I've got all of that documented. I'm going to do kind of a general assessment, and then we'll get into the areas that you said are more concerning specifically. Are you in any pain right now? Are you having a headache right now? Any neck pain at this time?
Just a little bit neck.
A little bit on the right side? Okay, so I'll definitely keep that in mind. I will need you to perform some mobility testing. Obviously, it's going to cause you a little bit of discomfort. Anything that feels, particularly painful, let me know and we can pull back a little bit, okay?
Thank you.
Of course. And then you did say you were having trouble sleeping. All right. Okay, I think that's all I need as far as your preliminary assessment. Let's see. Okay. The last thing I wanted to ask you is, do you have any history of injury? So any back injuries that have happened in the past, maybe when you were a child, any like blows to your head? Do you have a history of concussion, anything like that?
No, I haven't had any history in that.
The reason I ask is sometimes even injuries that might have occurred years and years ago, they can become a problem later on in our adult life. So just want to make sure, but that's fine. And then as far as your day-to-day activity, have you started doing anything different? Any increased physical activity? Any new sports? Change of job? Excess stress?
Just normal gym and then working from home.
Okay, so you work from home. Do you spend a lot of time on the computer then? Okay. All right. That could be something that is related, especially if we're looking at a posture problem. So I will do a bit of a posture assessment and assess to see kind of if this is like a strain just from looking at the computer or something like that. That is very common, especially in this day and age. So have you worked from home for quite some time now?
Yeah.
Okay. All right. Do you typically use a laptop or a phone or like a desktop? Okay. And just to follow up there, would you say that your laptop, when you're using it most hours of the day, is it at like eye level? Are you typically looking down? Are you working at a desk or like a dining table?
I have a standing desk.
A standing desk.
Standing
Okay.
or sitting.
And do you use it both positions, standing and sitting? Okay, so that's actually good. Do you use an external mouse or just kind of the trackpad that's on the laptop?
That's on the laptop.
Okay. All right. So those are all things that I will just keep in mind. So we can go ahead and get started with your examination. Did you have any questions for me? Okay. All right. So let me just set this aside. I might come back to my notes, but for now I will just set them out of the way. All right, Maddie, so we're going to go ahead and get started with our physical examination. So I like to start off with just a visual inspection. So I'm just going to have a look at you kind of as a whole, see if I notice any asymmetry or misalignment, and then I'll have a bit of a closer inspection. So I want you to just sit in a position that feels kind of comfortable and natural. So don't try to overextend your posture, just very, very natural how you would sit day to day. And I'm just going to observe. So I do see. Is it okay if I just move your hair? I'm just going to place your hair in the back. Beautiful, beautiful curls.
Thank you.
Okay. Very, very mild misalignment at the shoulder. So you're just slightly lower on the right side. It's nothing that's super significant, but I noticed just a little bit of lowering here. So that's consistent with you experiencing more pain on this side.
Mm-hmm.
Neck looks okay. I'm not noticing any bulging or any sort of swelling there. I could have you just lay your hands on your lap for me. I just want to have a look at the elbow placement as well. That's good. So, notable alignment with the mid-abdomen, which is good. All right, shoulders. Slightly more forward on the right side, I would say. Okay. That looks okay. All right. I'm going to have you perform just some very basic motions for me. Again, if it really hurts, we can, you know, kind of pivot, but I'm going to have you turn your head all the way to the left. Any pain there?
Mm-mm.
Okay, that looks good. And if we can then come all the way to the right. Any excess pain on that side?
Mm-mm.
Does that feel pretty similar either side?
Mm-hmm.
Okay. And then if I can have you just go back for me, so extend back and forward. And all of that felt okay.
Mm-hmm.
All right, good. Okay. I'm going to have you just extend your arms forward for me, so just out in front of you. Any excess pain there?
A little on the right.
A little on the right. And if you start to slowly extend all the way up above the head, does that hurt any more?
Mm-hmm.
No, that feels okay. And if I can have you go back behind you, any excess pain there?
Just a little bit on the right.
On the right. Okay, you can go ahead and relax. And when you say there's a little bit of pain, is that in the shoulder specifically?
Mm-hmm.
Okay, all right. Okay, so definitely need to have a look there. Would you say it's more in the front or more in the back, or kind of both?
Kind of both.
Kind of both. Okay. All right. Does it hurt at all as I touch you here? That doesn't cause you any excess pain?
Mm-mm.
Good. Okay. All right. So now I'm going to do some palpation. So palpating just means I'm going to feel around with my hands. So is it okay if I go ahead and touch you at this time?
Mm-hmm.
If anything feels uncomfortable, you can let me know. You're welcome to close your eyes or just whatever feels more comfortable for you. So I'm going to start here at the cranium. So feeling around the temporal region. I'm going to feel for any nodules, anything that feels particularly swollen, if there's any abnormality here that could be causing the headache. You said sometimes your headaches are here in the front, so these tend to be either more related to your sinuses or tension headache, so typically caused by stress or strain of the musculature. So do you feel just a little bit of warmth here at the temple? Are you tender here at all?
Mm-mm.
Coming down along the jawline. Do you ever grind your teeth at all?
I don't know. If I do, maybe in my sleep.
Okay, so that is fairly common. A lot of people tend to be teeth grinders. So just checking for any signs of TMJ. Any pain or tenderness here?
Mm-mm.
Good. Okay. And then as I come down the neck, I don't notice any swelling. I'm just going to feel along the clavicular line here. So a lot of testing is kind of ruling out what we don't think it is, and then we can kind of narrow down what we think might be causing it. So some of these questions might seem like they're unrelated to your symptoms. Okay, I'm just going to come over on this other side. Just feeling around at the shoulder joint. Okay, all right. I'm going to come back behind you, Maddie.
Okay.
All right, so I'm just going to start by having a look from behind. more on the right side since you said that's where most of the pain is. Again, just seeing a tad of that misalignment here, but it doesn't look too severe. Just going to feel front and back here. All right. Feel just a small pocket of edema here. Do you tend to have some of that discomfort here?
A little bit.
Okay. Okay. So I am going to extend your arm for you. I want you to just kind of rest the weight of your arm. Tell me if at any point this kind of hurts a little bit more.
About there.
There. And if we come out.
A little bit, yeah.
A little bit there. And if we come back like this.
Not as much.
Not as much. Okay, so I would say that maybe this position is the most painful. Okay, all right, you can go ahead and relax there. All right, Maddie, I am going to perform a bit of a posture assessment now. This is going to be kind of passive. It's more so me manipulating you. So I want you to just relax as much as you can. I know it can be kind of hard to allow your body to just be moved around. So just try to relax if you can. If any of it becomes painful, let me know. So this is what is kind of known as the Alexander technique, in that it's a more passive posture assessment. So instead of me having you perform things, I am going to move you around here. So just relax for me. I'm going to start with some very mild postural adjustments here. So just feeling for what I think could use some correction. So I'm going to pull back here slightly. Let's see, head alignment. Just raise you here just a touch. Good. That looks better. Okay, so now I want you to go back into your natural positioning. Good. Good. Okay. So let's go. I'm going to go about 2 degrees here. Good. Good. And we'll align here at the elbow. And align here at the elbow. In at the navel. Very good. Right, so I'm just need some mild posture correction. That feels a little bit better. Okay, Maddie, I'm going to ask you to breathe all the way in at the abdomen. So deep breath in from your belly. And we're going to go all the way out. Very good. Very nice correction there. That's nice. Nice and tall at the shoulder. Very squared. That already has you looking a lot more centered. So that's a good sign. So oftentimes, a lot of our chiropractic issues come from either poor posture or breathing incorrectly, which I realize sounds silly because doesn't seem like there should be more than one way to breathe, but there definitely is. So when you're taking proper breaths from your diaphragm, it can kind of naturally do a course correction, and it does appear so your shoulders are much more squared now. So that's nice and tall at the waist. Okay, so I'm going to have you do that one more time. Breathe in from the belly. And breathe all the way out. Very good. Does that position feel uncomfortable for you at all? That's okay? Good. So now I'm going to do some isolated palpation here at the shoulder joint. So feeling around. You have a bunch of tendons in here, and this is what allows you to kind of rotate at the socket and control the shoulder. Excuse me. So bilaterally, I don't feel too much of a difference. I do feel some tightness here. I'm going to grab a couple of tools here. All right, so now that I'm back around the front, I'm going to do some testing here with a couple of tools. So before I start, I just have this tool here. So this is going to test for any signs of inflammation. So just to give you an example, I'll use your hand here. It is very cold to the touch. So your hands are quite warm. It is very cold to the touch. So you're going to feel me just kind of gently drag this across your skin, around your face, and around your neck. Okay, good. So just want to give you a fair warning. Sometimes the cold metal can be a bit startling. So I'm going to start here at the temporal region. And this will just indicate if there are any areas that are reading more inflamed. Okay, so far that looks okay. Very mild indication there. Okay. I'm just going to test that on the other side and see. Okay. So some inflammation here on the right side of the neck. I do see it visually, but it's interesting that it was picked up because it doesn't appear that significant to me. So I'm going to do some tests for temperature variation now. Okay. This is just a regular thermometer gun. It's just going to read the temperature and it'll tell me if there are any areas that are hotter than they should be. So let's start by just getting a base here. And you are actually a little bit warm to start with at the forehead. Cooler down at the neck. Nothing that appears too concerning. I am getting just a little bit of warmth here, but that is normal. We're indoors, so that's okay. Okay. All right, so I am going to have you perform just a very brief test for me. So I have two identical objects. I'm going to place these in either hand. To start with, I'd like you to squeeze them for me. So I'm just going to move your hands just here. So just squeeze. Do you feel any difference in your hand strength? Does it feel the same from one side to the other?
Yeah,
okay.
it's the same.
And then if we rotate your hands just externally and then raise up and down, and then rotate facing up and out and in. Very good. Okay. So having something in your hand allows me to test for posture if it's different from one side or the other. You did very well there. Didn't notice anything that looked awry. Now I have this tool here. This is just a modified reflex hammer. So I'm going to tap along certain areas, the bony prominence. So again, just a light tap. It is a little heavy, but it shouldn't cause you any pain.
Okay.
Okay. So I'm going to start here at the clavicle. Allows me to auscultate for any audible differences. Slight variation there. Any tender spots so far? Good. Right along. Bone here. We have another tool here. I'm going to use this to test some brief reflexes. So several reflexes along your face as well as along the upper extremity. I'm going to test just a few of them to make sure that there's nothing that's not working properly. Okay. So I'm going to start in between the eyes. Okay. So I'm going to just rotate your head forward here. Okay. I want you to just look at a point across the room. Anywhere is fine. And I'd like you to keep your eyes open and then blink just as you feel you need to. Okay. So I'm going to bring this object towards your face. I will not be hitting you with it. I'm just going to bring it towards your forehead. Okay. Good. Just gonna move your hair here. All right, that looks okay. I'm gonna have you hang your jaw just kind of loosely for me. Okay. Perfect. Very good. All right. Then at the shoulder, I'm just gonna do a twitch test here. So again, I'll have you just look straight ahead. Okay. Good. Okay. All right. So we're gonna test here at the arm. So I'm gonna hold your arm up here. I want you to just relax the weight for me. This kind of feels a little bit uncomfortable. It's right on the ulnar bone. Good. Good. And then again at the wrist, just rest the weight of your hand for me. Very good reaction there. And then lastly, I'm going to test at your ring finger. I did hear a crack in the shoulder there. Okay. Yes. Does that happen fairly often?
Sometimes, yeah.
Okay. Only on the right side?
Maybe.
Okay.
Or maybe just raising it.
Good. No rigidity there. Okay. You can go ahead and relax your arm. So that was interesting. As soon as you raised your arm, I heard it pop. So. All right. Okay. Okay, so if it's all right with you at this time, I'd like you to turn around for me so that I can have a look at your spine and then the back of the shoulder as well. Okay. Okay. Just move these out of the way for you. All right, Maddie, so jumping into the posterior assessment here, are you okay in the position that you're in? All right. So I'm actually just going to split your hair down the middle here so I can have a look at the back of your neck. See some slight distension here just at the base of the neck. Do you have any tenderness there?
A little bit,
A little bit, okay. All right. Okay. I'm going to come down along your spine with my fingers. I want you to tell me if just any of that is uncomfortable. So any discomfort in any of the individual vertebrae as I come down? low back, you said you had a little bit of pain. Does that feel
Yeah,
okay?
around there.
Around there. Okay, so that's right mid back at kind of the small of your back. You do have a bit of a higher arch here, so you have the small of your back kind of goes in just a little bit more versus thoracic spine here kind of protrudes a little bit more, so it could be that you're experiencing some discomfort there. Again, I think that's more of a posture issue. So I'm going to do, again, that same test with the cold device. So this time on the back of your neck, obviously, you're going to feel very cold here. All right, I'm just going to hold your top down. Start at the very, very base of your spine. And come down about here. Yeah. So very mild indication of inflammation here. I have a smaller tool here, Maddie. It's another reflex hammer, just much more pointed. So this allows me to get right in between those little bones that you have just down along the spine. So I'm just going to percuss. Any pain here at the lower back?
It's okay.
It's okay. As I come along, any difference in pain there?
A little bit on the right. I feel.
Okay. Anything at the mid back?
Yeah.
Yeah. Okay. All right. I'm going to take a couple measurements while I have you facing that way. So I have several different tools here. This first one's going to allow me to measure for the curvature of your overall body. So just have a very interesting looking ruler here.
Okay.
And on the right side, I'm just going to measure that curvature of the scapula, which is actually within normal range, so that's a good sign. Bilaterally symmetrical with the left side. I would say you're only about a couple centimeters off there, which is normal variance.
Okay.
I do definitely see inflammation here at the top of the thoracic spine. So the very part of your body that turns from your neck to your back, just a little bit of elevation there, and that is likely from your work from home use of the laptop and just kind of need for posture correction there. So something that I see very common, specifically with my patients that are your age. We're kind of in the digital era here, and just the natural looking down at the laptop, looking down at our phone, that is very common. So. And then at the low back, you have a very small waist in comparison to your hips, and that's just causing a bit of that lower back pain here. So your hips are kind of overcompensating here because you've got a very tight waist. So that's definitely common as well. Something that can be corrected with posture as well. I do think that if we focused on some diaphragm breathing, we can bring that in a little bit. So how we did earlier with the posture correction, I'll do that again. I just want to take a couple base measurements first. Okay. So I'm going to go in now with this here. I'm going to measure shoulder to mid back. You're at about 10 1/4. How tall are you, Maddie?
5'5".
Slightly off center there. Yeah, you're only at about 9.5 there, so about a 3/4 inch difference. 18. And just shy of 19, so not too big of a difference there. That's good. All right. This last ruler that I have, allows me to measure ankles. So I am going to just move your hair here. Okay. So I'm going to have you turn your head all the way to the left as far as you can. I'm going to hold your shoulders steady there. We are going to measure. Okay. Right at about 115 there. That's good. Okay. Then if we can do that all the way to the right side again, I'll just hold your shoulders here. We will see if there's any significant difference here, and I can already see that there is. Not terrible, about a 5 centimeter difference there, so you can go ahead and return midline, that's fine. Okay. Just gonna measure this as well. It's about 110 there, so that lines up. And again, about 120. Okay, all right. So I'm going to do some of those same posture corrections from earlier, this time from the posterior side. So again, just kind of sit in a very natural, comfortable position and then allow me to just manipulate a little bit.
Okay.
All right. So I'm going to start the gentle correction there. Good, nice and square. Have you breathe in from the belly for me, Maddie? Good, very good. And one more time. Very good. All right, that already looks quite a bit better. And less inflammation there at the thoracic spine, so that is good. Just gonna use a flat tool here, just looks kind of like a spatula.
Okay.
And I'm just gonna kind of graze this along your back. Just allows me to feel for any nodules. Looks okay. Just doing a bit of a deeper palpation here. All right, that looks okay. All right. All right, Maddie. I'm going to go ahead and have you turn back around on the table and we can kind of discuss what I think is going on, okay?
Okay.
All right. Now, have you ever seen a chiropractor?
Only once or twice.
Okay. Have you had traditional adjustments done?
Mm-hmm.
Do you feel like it was beneficial for you?
Mm-hmm.
You do. Okay. All right. All right. So you have seen a chiropractor. About how long ago was your last adjustment?
I think 3 months ago. Maybe?
Okay, so not too long ago. And were you seeing a chiropractor for previous back pain or just?
Mm-hmm.
Okay. All right. Okay. So I think a more mild adjustment would be good for you. I don't know that you need any more structured kind of cracking of the bone adjustments. I think some more posture correction would help and just kind of remind your body what natural alignment feels like.
Okay.
So if that's something that you think would be beneficial, I can definitely refer you in for another appointment and we can do a more dedicated, posture assessment now that we kind of have a better idea of what's going on.
Perfect.
Okay. All right, so I will have to take a look at my schedule and see. I can maybe try to get you in within the next few weeks. Have you already gone ahead and filled out your portal online?
Mm-hmm.
Okay, so I can send you information over there as far as availability, if that's okay?
Perfect.
Okay, all right. So I will go in today. I should have some time later today. I'll have a look at my schedule and see what works, and then hopefully we can coordinate to get you in.
Okay.
Okay, all right.
Thank you.
Well, thank you so much for coming in, Maddie. I sincerely hope we can have you feeling better soon.